The Minister of State for Health in charge of general duties, Anifa Kawoya Banjirana, has called upon striking doctors to rethink their position and think about saving lives first. Honorable Anifa was officiating at a belated International Fistula Day in Zombo district on the theme End Fistula Now, Invest in Quality Health Care, Empower Communities. These are the details.
Uganda has marked the belated International Day to End Obstetric Fistula in Zombo district, West Nile. Obstetric fistula is a hole in the birth canal caused by obstructed labor in the absence of timely medical care, leaving women to leak urine and feces. Left untreated, it can lead to infections, diseases, and infertility. According to the Uganda Demographic Health Survey of 2016, between 75,000 and 100,000 women are living with obstetric fistula, and about 1,900 new cases are added to the already big backlog of women with this condition. Over 50 cases of fistula have been registered over the past 2 years in Zombo district alone. Officiating at the ceremony, the Minister of State for Health, Anifa Kawoya, called on mothers to seek antenatal care and ensure they deliver and a skilled health worker.
It is aligned with the priorities of government to invest so much in quality health care service, and over the years we have been grappling with the challenges of having mothers deliver with skilled provider in hospital. It is this time today, not yesterday, that we must emphasize to call upon the mothers to seek antenatal care before it is too late. Our emphasis is that at every sub-county there must be a real, fully fledged maternity to take care of our mothers, to take care of our children, to ensure that there is health service for the vulnerable groups. And I'm happy that the UNFPA has given even us equipment that are going to help us to end fistula.
Minister Kawoya also launched the 5-year National Obstetric Fistula Strategy, a collaborative initiative between the Ministry of Health and its various strategic partners like UNFPA that will support several interventions to tackle the complex pregnancy-related complications resulting in severe maternal morbidities. The strategy aims at eliminating new occurrences of obstetric fistula, reducing prevalence of women with fistula, rehabilitation and reintegration of all treated women into productive social life.
So that is what we do, and in terms of ending preventable maternal deaths, addressing fistula is one of them. And how do you address fistula? One, you heard me talk about family planning, because if you plan your family, then you don't get pregnant, and therefore a less chance of getting fistula. But looking at Zombo and many of our communities, health facilities are very far. So the best prevention is not to become pregnant at that early age.
According to the minister, in order for the strategy to succeed, full input of health workers will be needed, not strikes.
We are working on your salary enhancement. And what surprises us, when you are having some little, you are working. Please don't kwekarakasa anymore. You go back to work as the government continues to look into your issues.
Earlier, Minister Anifa Kawoya, accompanied by the Minister of State for Northern Uganda, Grace Freedom Queen, and legislators from the region, visited World Health Center for in Zombo district, where a surgical camp to handle fistula cases has been taking place since Monday. By press time, over 22 women had been successfully operated out of the 35 that are scheduled to be repaired at a camp that ends this Sunday. Benatiga, UBC.